It also dawns on me that there's so much to be said about why this is so important, other than the obvious, which is we need to have healthier people, including women, um, but that there's a lot to be gained by having healthier women. So, Jody, you wanted to say something about that?
Yeah, I mean, I think women really, ultimately are kind of the core, I think, of what makes our world and our government go around, right? If you think about the fact that not only all the work that mothers do to keep families moving, but women are the primary uh, consumers in their household, right? They make 80% of purchase decisions. They make 80% of the healthcare decisions. And so if that woman, or the woman who's sort of the center of the core from a commercialization standpoint in our economy, a consumerization standpoint in our economy, and a healthcare standpoint in our economy isn't healthy herself, then we're all going to feel the effects of that. And so that's why we really need to prioritize. And this is not a women versus men thing. It's about really making sure that women have what they need from a healthcare perspective, so that they can be mentally healthy, physically healthy, economically healthy, and socially healthy, so that they can then give the rest of themselves back to others, and frankly, drive our economy and make others healthier in our universe too.
And
Yeah,
just
well,
to add to that, to put some real numbers on it, so some of you may be familiar with WHAM, Women's Health Access Matters. They conducted a study to show the numbers behind the economic impact of investing in women's health. So right now, NIH spends about 11% on women's health as far as their extramural grants. And what WHAM did is they studied four areas: heart, brain, autoimmune, and cancers, and specifically lung cancers, because we are seeing such a huge increase for non-smoking women. So just in those four very specific areas, they found if they were to double the current NIH spending in women's health research, which would be about $350 million, sorry, $350 million, it would return $14 billion to the economy. So that's a huge ROI. So we all benefit if women are healthy and thriving. It's just so critical to drum that point home.
and to that end, the president announced earlier this year, or maybe it was November of last year,
Yeah.
about increasing funding, because that's what we're really talking about. If you have to fund the research in order to have the research in women's health.
Yeah, so he launched in November this women's health, this first ever White House initiative on women's health research, and gave 45 days for all the agencies to report back on what they're doing on women's health and recommendations to address gaps. And many of us in the field helped shape that. We provided information from the VC perspective, the entrepreneurial CEO perspective, and then the access to innovation perspective. And then as we entered this year, the top of this year, then he started to put real money behind that. And so he proposed $12 billion first ever for these centers of excellence on women's health across the country. He put right away 200,000 into interagency coordination around women's health research. He made 20 different executive actions through an executive order. So he is definitely, he and First Lady, it's really First Lady Jill Biden that deserves, Dr. Jill Biden that deserves a lot of the credit for all this work. But it's been across the board administration support from President Biden to Vice President Harris to the First Lady and on down. And so what this does is this kickstarts an activity and energy around this, but it's just proposed money. There's no actual new billions of dollars in this area, except for ARPA-H. So the ARPA-H Sprint for Women's Health program was a $100 million initiative also earlier this year for women's health. And they actually just made announcements. We worked with one company in particular in menopause, ovarian health. They just got awarded their notice of their award. So dollars are starting to hit the street on that, which is great. But when you look at the gap and how many thousands of applications came in, and in fact, if you total up all the applications that came in for that ARPA-H $100 million opportunity, it was about $8 billion. So there's huge need. There's still a lot more dollars that we need to dedicate towards this area, but hey, it's a start.